This is Alcohol Abuse by Donald Hill
James Kallis.
and Vincent White.
So, how do we define characteristics of alcohol abuse? Well, alcoholism is one of the most serious form of problem drinking. It describes a strong and often uncontrollable desire to drink. An alcoholic will often place drinking above many other things in life, possibly work or even family obligations. So, as an alcoholic, will eventually build up a physical tolerance and experience withdrawal symptoms if they stop drinking. It's terrible. How would we classify diagnosing or recognizing a problem? Well, many times there's a specific criteria that if two or more of the criteria are met, then in a 12-month period of time, then you are considered an alcoholic. We actually put 6 bullet points or 6 examples of these criteria. There's actually a few more. But just as examples, if you are unable to control how much you drink, if you're having to drink in order to feel normal, if you're storing alcohol and hiding it in places to keep it secret, if you're drinking in secret, or if you're continuing to drink despite negative consequences or problems that arise in your personal life. Also, experiencing blackouts on a regular basis or periods of time when you can't remember is a big concern.
So, in order to identify alcohol use disorder, there are a couple things we can look at. So, some signs and symptoms, which you can find, also commonly found in people that are intoxicated, are those that are demonstrating poor coordination, slurred speech, impaired thinking, memory impairment, engaging in risky behavior. Most commonly, especially in this county, is drunk driving. And lastly, if people do go a period of time without drinking, they experience like shaking, anxiety, and just a strong urge or desire. So typically, when you are experiencing withdrawals, it's a symptom that's commonly associated with alcohol abuse. Um, if you haven't experienced it before, um, you may come across the feeling of feeling, irritable or anxious. You may have tremors. You may begin to get angry or impatient. It's really common when people have an addiction that kind of takes over, and it may be stressful for you. Your blood pressure may begin to go up, your heart rate might go up, and after a prolonged time of abstaining from alcohol, you may even become agitated and hallucinate. And what's even pretty common are what's called DTs, or delirium tremens. It's when people are disoriented and anxious and restless, and it's pretty common in the ER setting too. You have people who come in and they're sweaty and they're abstaining from alcohol, and they can even have seizures. Some even more common signs and symptoms are hyperactivity of the autonomic nervous system, and so you'll see like pupil dilation, again with a fast heart rate, uncontrolled hypertension, and profuse sweating, also known as diaphoresis. So some statistics in San Joaquin County, they're pretty remarkable if you look at them. I looked at a community health needs assessment performed by Dignity Health from 2019, and you'll see that some of the statistics show that deaths by suicide, drug, or even alcohol poisoning are at 46% for every 100,000 people in this county. Excessive drinking is at 35%, and impaired driving deaths are at 34%. Those are some pretty high numbers for this county. And, there are measures that should be taken and will be taken to reduce the likelihood of this happening. It's also worth noting some risk factors that cause people to drink. People that drink, they do typically come from an area where there's low education, high stress, depression, peer pressure, mental health conditions, and even low socioeconomic status. It's a huge contributor.
So now that I've learned about alcoholism and the effects of alcoholism, now I have to figure out if I'm a candidate, and where can I go for help? How do I address this situation? Maybe I'm even afraid to address the situation, or even just ask questions. Maybe I just have some questions that I want to get across to somebody to help myself out with maybe some problems that I'm facing. There are some community health resources that are available, and one resource in particular, Substance Abuse Mental Health Services Administration, which is listed here with the helpline, is available 24 hours a day. It is a confidential resource, so you can call them any time of day confidentially and ask for help. The other local resource that we do have here is the Delta Intergroup of Alcoholics Anonymous, and they have their listed hours there available to you. They are also accessible through mobile device as well. Great resources to help out with people that might be suffering from this disease or its effects. So next, as a nurse or healthcare provider, we have to ask ourselves the question: how do we contact who gets screened? How do we address this issue when we are challenged with a patient that may fit the description? A lot of times we get patients that might have toe pain or a cut to the elbow, and we might just treat them for that, and we send them on their merry way, not addressing the fact that they might have come in under the influence. They're chronic emergency room users, and we might see this patient over and over and over, knowing that they might have an alcohol addiction or problem, and we may never address it because we want to get them out of our room. We want to get them out of the facility so we can save time. We can move on to another patient. That being said, we need to address the issues. We need to be able to be a resource for our community as healthcare providers. We need to recognize who needs treatment when they do present to us. So that being said, who gets screened? Everyone. Everyone should be screened. We should always be on alert as healthcare providers to be that resource, to recognize, because most people don't want to address it themselves. So if we can break that ice and address it for them, maybe that's all they need to seek the help that they want. With our community, being in the homeless population in our community, we run into a lot of problems with access to help. Even though we do have some resources, our resources are very limited to our specific demographics with the specific community. And the reason is there's very few resources for getting people help with current alcoholism or problems with. Most of the resources are geared towards prevention, and those typically speak for themselves. As we try to prevent disease, we try to catch it at an early age. So most resources that we encounter, including on Healthy People 2020, any type of articles, most of them are geared towards the adolescent population, young adult population, mostly consisting of college students, military personnel, trying to help people prevent factors that are leading up to alcohol abuse and drug addiction. That being said, with that little bit of information, it lets us know that this is a very difficult problem to take care of. We understand that this is something that needs a lot of attention and is not going to be an easy issue to remedy.